I think before anyone considers testosterone replacement therapy, they should go to someone that tests that, because we've talked about the pros. Okay, so the pros being very nice, that it makes you feel more lively. There could be an increase in muscle mass. There could be a decrease in your body fat. I mean, there's quite a few things that can be nice, but the bad part, there is cons to taking testosterone too early. And I mean, we've all heard the value or the young 28 or 30-year-olds that have been put on testosterone. So yeah, if we think about the bad things, I mean, the first thing that springs to mind is you can actually make someone sterile.
Absolutely, and hence also the age at which the patient presents to you. So if it's a 45, 50, say 50 plus year patient coming to you and they're done with the family, they don't want more kids, then it makes it easier. You can have the discussion if they excluded certain things, but the decision to treat is easier. I think it's in the younger age group where you really need to think what you're doing. Okay, and you don't want to start on treatment without doing all the other things right first, and then the treatment options will also differ from what you will do in a 50-plus person.
And I think just to reiterate what the things are that you want to do to make sure your testosterone is at a good level. Number one is sleep, and we've been saying it since our first podcast, is that sleep is your superpower. You need to get enough sleep. And I think the next thing is pick up heavy things. You need to do some form of heavy lifting. So if it's not weightlifting, high intensity interval training, so you need to do quick, fast, heavy stuff. The zone 2 training here won't do the trick really for testosterone production. You need to tell the body, I need it. I need to be bigger. So
yes, absolutely, and also exclude certain things in lifestyle. I mean, just like don't drink too much. I think in South Africa, we've got a drinking culture almost, and some people might think like half a bottle of wine a night is normal or it's okay, which it isn't. I mean, the newest data coming out shows that no amount of alcohol is good. So, yeah. And that definitely suppresses the LH and testosterone secondary to that.
And the other side is, it interferes with your sleep so much. I don't think people realize how bad they sleep if they've even had one glass of wine.
So sleep is an interesting thing because it goes both ways. It's like a lack of sleep can reduce the testosterone, but also low testosterone can have havoc on your sleeping pattern. So, and that's the same with sleep apnea as well. It can be the cause, or it can worsen it. So you need to really look at the person in a whole and need to screen through everything and then have the discussion on treatment or not.